This really helped a lot, yeah. So that her last days were with people she cared about, and she felt comfortable. And that was a very stressful time because she was getting sicker. We were thinking, okay, we don't want to take her to hospital again, the risk of hospital-borne infections, and it's very disruptive. But then to get the care for her at home at that time was very difficult. And finally she got to a state, and we were, ringing around and say, okay, I know this nurse here, I know that nurse here. And then when the nurses come, it becomes very expensive if you have to keep them around the clock. We started thinking about palliative care, and we were told we have to think about it. But again, in the hospital, we weren't really told how to get it or where to get it. I'd heard of hospice before, so we're trying to contact hospice, and they seem to be extremely busy, but also say, oh, we don't cover your area, you're in Ampang, we don't cover that. So where do we go, where do we go? It's all sort of very random and ad hoc. And then somebody from our church, whose father had been ill for some time, and then he actually passed away. And then when we talked to them, they said, oh yes, Beacon Hospital is wonderful. Such a relief that when you came on board and you could do all of that. Here, you could do all that. So that was a huge relief, and at least that took away the stress of that. We knew what to do, how we could manage at home. And nobody had really a practical solution. Somebody said, oh yes, you can get a nurse, but the cost of nurses per hour is huge. And really what she needed was somebody to set the drip, and then for us to maybe monitor it, and then maybe come in once or twice a day to check on it, or to take the blood when needed, that kind of thing. So we were able to provide that, and then we were able to manage in between on our own with your guidance. So that was a big help, yeah. And I think it's really, we're so grateful to you that you enabled it as for her to care for her at home, and that she was in her familiar environment with people she was comfortable with, and then her friends or her family, other relatives could come and see her easily. This really helped a lot, yeah. So that her last days were with people she cared about, and she felt comfortable and safe.
There are a lot of families are going through what you had gone through, you know? I think, is there a message, or is there something that you like to share with them?
So when we find, it was such a huge relief for us, because, okay, there's somebody who knows what to do, then, and they'll guide us on how to do it. And you can see, that mom was being cared for, and she's made as comfortable as possible. She needed antibiotics, she was given the antibiotics, and then she could fight the infection, and so we got her back a little bit more, and so that was a huge relief and help. And I just wish, I think it's really important for more people to find out about these options, and then they can access them. And if it can be available, I think you're affordable, at least we found it affordable, but other people may not. But there should be options for everybody to access it, because everybody has a right to dignity and to be as comfortable and as happy as possible, and that place is at home. So if at all possible, I think we should try and give everybody that option.
Thank you so much, Mr. Chacko, for
Thank you. Time. Really, it was such a help to have you and your team there in these difficult months with Mom. So we're always grateful for that.
Yeah, we're honored to be able to take care of Puan Sri and the family as well.
Thank you. Thank you so much.
Okay. I think for palliative care from Beacon Hospital, we do have a home care team that can see a patient at home. So if any one of you have the need, do contact us, do contact the hospital for you to understand a little bit more about our home care. Thank you.